What's up, everyone? I'm Gabby, and I am a breast cancer survivor. I was diagnosed when I was 36 years old. We can't close out the month of October without discussing breast cancer awareness and how to do a self-exam.
Women are getting diagnosed younger and younger nowadays with breast cancer. I'm Felicia, a women's health nurse practitioner. Let's go over how to perform a breast self-exam and what you can look for. You want to start from the time your period starts up until about 2 weeks after. That's when you're going to notice the least hormonal changes. You're really just trying to get familiar with your breast so you know what's normal, so then that way when you feel something abnormal, you'll call your provider. You can do this while you're in the shower, you could do it while lying down, but also in a mirror. What you want to do is put your hands on your hips, shrug your shoulders up, lean forward. If you see any pulling or dimpling in, that could mean that there's a tumor underneath the skin. When you do your breast self-exam, you're going to actually use the 3 pads of your fingertips. You can either do a piano-like method where you're going around the outside, or you can even do though also like just a massage with lighter to deeper palpation. You're going to start from the outside of your breast and then work your way in, kind of like a spiral, and take your time doing it. And also, please don't forget to check underneath the armpit as well. You're feeling for any swollen lymph nodes. So if the lymph node doesn't go away or if it gets any bigger, you want to be seen right away. Aside from feeling for lumps or bumps, you also want to look for any changes to the skin, like any dimpling, redness, any spontaneous nipple discharge, meaning you're not even touching your breasts and they're just leaking. Also, if you happen to notice any itching or an orange peel skin-like texture to the breast. If you experience any persistent redness and swelling, that's a concern as well.
And if you've been breastfeeding and you've been diagnosed with mastitis, but medications have not been working and this has been an ongoing issue for you, please ask for imaging, as that can be related to inflammatory breast cancer, which is one of the more aggressive types. Breast cancer does not discriminate. It can happen to anyone, anytime. Somebody as young as 19 years old has been diagnosed with this. So please make sure you perform the breast exams.